This exercise is the half frog. We call it the half frog, and we include abdominal stabilization in this exercise because what we're going to do is ask the client to be able to stabilize their pelvis in the transverse plane as a result of tension that develops on the hip adductor muscles. So obviously the obliques are going to become involved in this. What we're going to ask Lori to do, as she lies here on the floor right now, her pelvis is flat and even on the floor. There's no tipping or tilting either side, even though her legs are in a little bit of an asymmetrical position. From here, we're going to ask her to let her right knee just slowly drop out to the side. As her leg drops out to the side, tension generates in the adductors. The adductors attach to the pubis symphysis, so what we may have in a person that does not have good transverse plane control would be the opposite side of the pelvis to lift off the floor like that. So when Lori comes back to the start, sometimes what we can use as a teaching tool is we can take a dowel or a roller and we would put it right across the ASIS on both sides. And as she goes and the leg drops out, it's important that as she's contracting through her abdominals here, that this opposite side of the pelvis does not come off the floor. So she's using a lot of her inner unit for stabilization as well as her more global oblique muscles for stabilization here. You'll notice that it's a nice controlled level of speed or rate that her leg is dropping, because if the client goes or the athlete goes too fast, they may actually miss the point of where the pelvis starts to rise. So often we'll have people do this for just a few repetitions, because for some people this exercise can be very challenging. The tighter the adductors, the more difficult the exercise may be for the individual. So this is not a static hold, but instead is a dynamic movement, but in a very slow and controlled movement so that the client can sense the change in the position of the pelvis as they go. We're also getting some active lengthening of the adductors as the person allows their leg to drop out to the side.